Guys, welcome back to Medical Coding with Blue. Today's episode is all about pursuing a career in medical billing and coding later in life. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so I got this comment from a viewer. We're going to read the comment and then we're going to get into it. So here we go. All right, so the viewer says, I'm scared to get started. I'm 45. 45 is not old, y'all. I'm just saying. And I have 20 years of customer service experience. I have no medical background, and I'm feeling like a fish out of water. I am unsure of where to start. So they made this comment on a video called Pursuing Medical Billing and Coding Later in Life, which is going to be the title of this video as well. But here's the thing. If you're making this comment, then you weren't listening in the original video. So in the original video, I talk about like where to start and what you can do, like as far as like what I recommend for like school wise. Everybody always asks me, what school do you recommend? What school do you recommend? I haven't been to these schools. Like I went to my own trade school that's no longer there anymore in my hometown. But I've always said that if you're going to pursue medical billing and coding, you don't have to go to these super expensive programs that you can study on your own. It is feasible if you do have the discipline for it. But I will say that you have to be very selective if you're going to choose one of these trade schools out there, because you may not always get what you're being promised, right? Oh, you'll have access to a teacher. And then I get the horror stories later of people saying that they promised me that and then I never had access to my teacher. So a lot of learning medical billing and coding is going to be on your own. That is a big part of it. And the two major medical coding associations, the American Health Information Management Association and the American Academy of Professional Coders, both have their online medical coding programs. And you can, with AHIMA, you can buy these courses a la carte, meaning that you don't have to buy the whole bundle all at once. Because if you do, you only get 1 year to complete everything. And it is doable if you're making the time to be studying. And it doesn't matter if you have a full-time job. It doesn't matter if you have a house full of kids and animals. You can make the time. If it's important to you, you will make the time. But I say all of this to say that you have your choice of where you go, and as far as like where you're going to learn. You can also learn on your own. I do have the independent syllabus. Now, the independent syllabus I will talk about for just a second. So this independent syllabus is designed to help you. I go back and forth sometimes wondering if I should leave it up or if I should take it down, because of the simple fact that when I'm telling you all the reasons that I suggest certain books, I still get a lot of like, oh no, a lot of arguing back and forth. I don't know why you're arguing with me, and I'm trying to help you. A lot of the books that I recommend, they're older books. And I still get the question, oh, can you use these in 2024? These are like from 2019, 2020 books or whatever. I do that because it saves you money. If you want to get the current year book, by all means, get the current year book. It's just designed to save you money, because guess what? Even older books, 85 to 90% of that book is still going to be the same as if you got the current year book, but you're paying more money for the current year book. So again, I'm just trying to help people out. Again, I go back and forth on whether I should just take it down altogether, because it just doesn't seem to register what I do, even though I tell you guys that, this is the reason that I suggest older books, is to save you guys some money. But if you want newer books, by all means, look for the newer books. But the older books do just as well. That being said, if you want to pursue this career field, it is absolutely possible, whether you're in your 40s, your 30s, your 50s, your 60s, because my audience is made up of many ages. I do have people from all ages watching my channel. A good amount of them are in their 50s and 60s. So it's not like this is unheard of for somebody to be at this stage in their life and pursuing a career in medical billing and coding. It doesn't come easy. You have to pay attention. You have to do your research. You have to be able to have that self-drive and that self-motivation, because you will have a lot of people telling you that you can't do it. Oh, you're too old to pursue a new career. You're too old to learn anything new. Is that true? I mean, is it really true that you're too old to learn anything new? Because to me, when I think about anybody making those kind of blanket statements on my life, I think, first of all, how dare you, number one. Number two, life goes by just like that. And I don't have to tell you guys this, okay? And for a lot of you, you have regrets of, oh, I didn't pursue this, I didn't pursue that, I didn't pursue this. No one is stopping you but you. Literally you. You're the only one stopping yourself. And as I said in this video, I said specifically where to go, how to start, and where to get going on. Get the books so that way you can study on your own. You can start studying on your own. But if you feel like you need like that one-on-one teaching and things like that, then find a program. Again, this person didn't listen when I said in the video, that's what you have to do to start. I don't know where to start. You know you want to do this. Why are you being lost? Why are you being lost about it? My whole channel is filled with all of the books that I recommend, how to get started, how to set up a study schedule, and how to pace yourself. That's the whole premise with the independent study. And the independent study video link is literally in all of the videos that I have posted over the last 3 years. It's literally in all of the description boxes. Independent study link with the book recommends. And I still get that question. Where do I go? Where do I go? It is possible to learn this on your own. But if you need somebody to teach you, if you need to go through a program because you say, hey, Blue, I don't have that much, I need somebody to guide me through this part. I need somebody to be accountable to. If that's what you're going to do, that's your business. I mean, again, to me, I don't know. I wouldn't put so much thousands of dollars into trusting somebody that I don't know. And just doing a crapshoot of what am I going to get? Am I going to get an instructor that wants to teach me? Am I going to get an instructor that really likes what they're doing, that understands and knows and is competent? Because believe it or not, there are teachers that get into these schools and just because they have a degree or just because they have a certification and they haven't actually coded in many years in the real world. So if you have a teacher who hasn't coded in the real world in many years, this can really affect how they're interpreting what's in the book to be able to teach you. So just keep that in mind because it's important to have an instructor who is highly competent in what they're doing. Now, I have said many times with the independent study video, if you want to go through the independent study on your own, and then hire a tutor for those moments where you're struggling, that's going to save you even more money because then it's going to be that one-on-one teaching time with you and just the instructor, or you and the tutor rather. Now, I am a tutor. My rate and contact information is in the description box below. I am currently booked until April 2024. So if it's right now and you feel like you need something immediate, I am not going to be available until after April 2024, okay? Just so you guys know that. But the thing about it is too, if you go on LinkedIn, there's a ton of tutors for medical coding on LinkedIn as well. So there's a lot of choices. You have choices. If you find one that you like, you want to stick with that person, then you start booking regular sessions with that person to kind of like do a check-in. Some people have done that with me where they really like my approach and they like the meetings that we have because I meet over Zoom and it's for an hour, these tutoring sessions. And they're like, okay, well, this works for me. We meet sometimes every week, sometimes every other week. It really all depends on the individual. But we're able to track their progress throughout. This is something that takes months to learn. It takes 9 months, 12 months, or 18 months of independent study, at least, if you're going to do that way. Even if you're going through a school and you may have picked a program that was 6 months or less, that's the first mistake that you made. Because any programs that are 6 months or less, that is just too fast. You need time. 9 months, 12 months, or 18 months. Remember, with medical billing and coding, we have to know what doctors know while never having gone to medical school. We have to be able to read and interpret their documentation. We have to be able to spot when we need to query and when we don't need to query. We have to be able to know those things. You have to be well spoken. You have to be able to write appropriately as well. And for so many people, they say, well, I don't like to read. Do I need to read? This is not the field for you. If that is your statement that you don't like to read, do not pursue this, because this is not for you. You have to read. And not only that, the guidelines that we follow must be read every single year. They get updated every single year. So there's going to be something new. And if you don't like to read, then that leads you down to like a miserable path, right? So you want to make sure that if you're choosing to do this later in life, that it's because you like to read, because you like to learn. And just because you don't have background in medical, before you get into this, I didn't have background in medical, okay? And I was in my later 20s when I started studying this. And then when I got my certification. So, it just, as long as you like to study, you like to learn, that's all you need. And then, of course, have the drive to actually study, then you're going to do well. But it's the ones that want, oh no, I want an easy job. I want something that's going to be just sitting at a desk and, it just be so simple. It's not simple. This is not simple at all. And I don't tell you guys this to make you panic or make you think that you couldn't do it. I believe people can do whatever it is that they want to do. It's when you start overthinking, like this person who made this comment did, immediately starts overthinking. Oh, well, I only have 20 years of customer service, and I don't have any background in medical. Okay, let's look at this. Okay, 20 years in customer service. If you were doing like over the phone customer service, which is what I suspect, okay, over the phone customer service, guess what? You have to verify that person's identity, right? You have to be able to protect that customer's information. So that's starting to understand what we do as far as protecting the information. That is a big part of what medical coders do. And then you have to be meticulous with, entering in the customer number and things like that. Those numbers have to be correct, and making sure that all of the information for that particular customer is correct too, right? If you have to order parts or something like that, or you're ordering items or whatever, those specific serial numbers and numbers, you have to be able to get them in the right order. Again, this is what we're doing when we're coding, except when we're coding, we're reading documents that are written by very intelligent people and using a different language, right? Which is medical terminology. Medical terminology takes years. I'm still learning medical terminology, and I've been a medical coder for 15 years. So I'm just saying, it is possible to do. But the thing that will stop people always is the what if, and being so scared. I don't know when we turned into a whole world filled with frightened people. Why? And what is it about starting in a new career that is so frightening? Well, it's the unknown. So how do we combat that unknownness, right? How do we combat that? By educating ourselves, by doing our research, by actually going to websites that actually will make a difference in your knowledge. The American Health Information Management Association or the American Academy of Professional Coders. Not going to places like Facebook groups that are going to fill your head with a bunch of garbage. Oh yeah, you want to do medical billing and coding? Yeah, then you could travel around, you could take care of your kids, you can do all of these things, and you can just run out during the day and come right back, and you can take care of, doing the laundry and all that good stuff, and you just work in, lies, lies, lies. This takes concentration. When you work at home remotely, which I do not recommend for anybody who's brand new. Why? Because all you're going to learn when you're learning medical coding in the beginning is how to medical code. You're not going to learn about the electronic health record until you get into the facility. Because in the facility, right, everybody uses a different electronic health record. Now, there's some big boys out there. Epic, Cerner, eClinicalWorks. These are all the big boys, right? And every package that they have is going to be different. So even though you may use Epic in one facility, that Epic may look a little different for another facility depending on their package. It's the same thing for anywhere you go. Same thing with Cerner, same thing with eClinicalWorks. So there's a lot of other things that you're going to be learning. But again, if you're doing your research wrong, going into these stupid Facebook medical coding groups that are just out there trying to sell medical coding credentials, sell you a bunch of books that you don't need, or trying to sell you a bunch of courses that you don't need, all these things, when you can, the access to everything that you need is right online. Medical terminology and anatomy, crash course on YouTube is fantastic for that. Ninja Nerd is another one that's really good too. There's a lot of really good channels on YouTube about medical terminology and anatomy. All you have to do is let your fingers do the walking, and no, I will not answer you if you ask me, because I just said it, okay? I just said it. And there's all these other resources, again, the American Health Information Management Association, the American Academy of Professional Coders, both of them. They're going to have their frequently asked questions about medical coding credentials and what you should know and things like that. All you need is one medical coding certification to start. You do not need a bunch of credentials after your name, especially when you have no experience, okay? Now, if you are in a program and you're going to be sitting for something that is not from the American Health Information Management Association or the American Academy of Professional Coders, you need to really reconsider that credential, because if it is not a HEMA or AAPC, that's not what employers are looking for. You can look at the job listings very easily. Type in medical coder and you'll be able to see all the things that they're asking for. Time and time again, they are looking for the American Health Information Management Association, a HEMA, or AAPC, the American Academy of Professional Coder credentials. You just need one. Never once have I seen a job listing say, candidate must have multiple credentials. Never have I seen that. So let's stop being afraid. Let's stop being so confused, okay? Let's stop just overthinking everything. If you don't know where to start, literally on my channel, there are videos about how to start learning medical coding. No, I am not going to put them on there. Oh, you can find it here, you can find it there. Why? Because you can look, and this is part of what you're going to be doing as a medical coder is your research. So that's why I invite you, friends, to go through the videos. Literally go through the videos, because I try to be as specific as I can about the subject and everything that I'm covering in that video. I try to keep it to that topic, but it really all depends. If you don't want to hear me in these long form videos, because that's all I do is long form videos. I do not do TikTok. I do not do little quick videos. Why? Because when I did try to do shorter videos, like for 8 minutes or so, people had even more questions. So I'm going to explain things in the way that is best for me, because I feel like that's how the message is going to get through to the people, okay? You can always speed up the sound of my voice so that it'll go faster if you don't have the patience. But I will say this, you're going to have to learn about patience. You're going to have to work on that patience, because if you are impatient and everything has to be quick and now, and you think that you're going to be able to learn medical billing and coding through TikTok videos, you're setting yourself up to fail, because your brain needs time to go through every single pace, right? We need a beginning, a middle, and an end, so that your brain has time to work through the problem and to figure it out. Because if you sit here and try to rush through learning medical billing and coding, it will never make sense to you. But if you listen and you take the time to go through my videos and look at all the resources that I have in the description box, I even have a video about free resources, guys. And still, so if you want to follow it, great, welcome. If you don't, that's fine too. This isn't made for everybody. But if you have decided that you want to do this, this is something that you want to pursue, do not let anybody talk you out of it. Do not let anybody tell you anything about your age. Do not let anybody tell you, oh, it's going to go away. Because guarantee you, that's somebody that's ignorant and doesn't know anything about our industry, has never probably been a coder, doesn't know anything about medical coding. Maybe they're a nurse and they said that to you, and you think, well, they're a nurse, they should know. No, half the time they don't know. And I can't tell you how many nurses come to me later and said, you know what, Blue, I thought it was this way and it's actually not, and you were right, and I was thinking it was this other way this whole time. Who are you going to listen to? Somebody that knows, or somebody that talks like they know? I don't talk like I know. If I'm going to bring something out, it's because I've done my research. It's because I've experienced it. It's because I know. That's why I bring things out. But in the social media age, there's going to be people that will call themselves experts, and they're actually not. And they're gonna say things, and you can tell once you start learning it, who knows and who doesn't know. You're going to be able to spot that real quick. But I'm just saying. So that's something that you have to decide for yourself. But stop letting other people scare you. Stop letting your own thoughts scare you about something that you don't even know yet. Do your research so that you're not afraid. It's when we don't know things that scare us, right? When we are ignorant, right? We get scared, right? Because we don't know. And there's another YouTuber that I love. He's not a medical coder, has nothing to do with medical coding. He just used to be a former cop, and he trained animals in the military and things like that. Rick from his channel, Think Like a Horse. He works with horses and things like that. But he says there's conscious incompetence and there's unconscious incompetence. So meaning that you know that you don't know, or that you don't know that you don't know. Because you don't know what you don't know, right? But in my case, if I don't know something, I will research, I will look, I will do my best to educate myself. I will go and find experts to talk with about what I have learned and to see if I'm on the right track. I'm not going to sit here and blindly follow people and, ask this person and that person and ask this person their opinion and what do they think, when they have nothing to do with my journey, when they have nothing to do with my path in life. Because again, guys, I don't have to remind you that life goes by just that quick. And by the time you know it, so many people are so busy running around procrastinating. They're so busy running around being lost and confused and not wanting to do the work, because the work is hard, right? You got to choose your heart. Either you're going to sit here and live with all these regrets for not pursuing a career that you wanted to, because you thought in your head it was this, it was that, it's going to go away, it's going to do this. They've been threatening that since 15 years ago, and probably a lot sooner than that as well. But again, guys, if you're thinking all that stuff about AI does not critically think. It doesn't. And the more that it gets sophisticated, the more expensive that it is. And think about this. Hospitals and doctors' offices are always looking to save money, not spend more than they're going to make. Okay? So that, I'm just being clear there. And no doctor uses the same language consistently when they're talking about their patients. Every patient is unique. And again, so many words are so similar, or could be more similar to each other, that you have to have critical thinking in order to understand what's going on in these things. And with AI, it's just looking for words and algorithm. That's all it's looking for. I'm just saying. So with that said, if you're going to pursue this, get in it. Pursue it. If you're only going to go half-heartedly, don't pursue it. Don't do it. Because you're going to be wasting time and money. Okay? I always talk about that. Don't waste time, don't waste money. Because that's the worst thing that you can do to yourself, right? And so many people say, I spent thousands of dollars because I wanted to be a nurse, so I wanted to go to nursing school, and they do all of these things. Then they decide, they didn't want to do that. And maybe they'll pursue coding. If you're going to pick something, pick something. If you're going to go after it, go after it. Don't be half-hearted about things, okay? Because the reward is going through all the hard times with whatever it is that you're trying to learn. And when you come out on the other side, it's going to be the best thing in the world. I don't work anymore. I don't work anymore. Just so I'm just going to say this before I tie it up. I don't work anymore. When I go to work, I'm excited to go to work. I'm excited to be there. And you think, it's because of the people. No, it has nothing to do with that. Some of the people, yes. But for the most part, it's the coding. It's the coding. It's the coding. And then when I can converse with my doctors and I can see that light bulb go on right in front of me, that I love. That I get excited about. Because that little seed that I've planted with them, they can take anywhere. And no one can take that knowledge from them. And they will be prepared for anything. They'll be prepared for not having a coder. They'll be prepared for having a new coder who doesn't quite understand. And then they'll be able to pass that that knowledge on to them if they're willing. Okay? So that's all I'm saying. Pursue it. Don't pursue it. It's entirely up to you. Make a choice. Don't overthink it. Just go for it if you're going to do it. Okay? That's just my advice anyway. So look through my videos, guys. Everything that you ever wanted to know is there. I'm just saying. So with that said, I'm going to wrap it up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.